All right, now to Washington, where it looks like President Obama's proposed health care overhaul could be gaining some momentum in the House. We have Congressman Peter Roskam standing by. He's a member of the Ways and Means Committee, which in the wee hours of the morning became the first to approve its version of the health care overhaul bill. Congressman Roskam, great to have you with us. And I understand the legislation was passed despite your vote of opposition. In fact, I think all Republicans on the committee voted against it. What really are your main points of contention with this bill?
Well, there was actually bipartisan opposition to the bill. There were 3 Democrats that looked at that bill and said, they weren't quite ready to sign up for that one. Look, the Congressional Budget Office came in and said 2 things. They said, we haven't had time to evaluate this bill, number 1, because you're putting 1,000 pages in front of us and you're rushing this through. And number 2, there is no indication that this is going to deliver the sort of cost savings that you're hoping for. In fact, the exact opposite is true. This is going to be very, very costly. And I think even today, the majority leader of the House of Representatives has said that they're going to have to go back to the drawing board on this, because this effort, I think the American public is simply weary of the type of spending that they've seen come out with the stimulus package that has underperformed, with a bloated budget, with a high energy tax, and now this, I think, is adding insult to injury.
Are you hearing that from your constituents specifically about the cost?
Overwhelmingly. Yeah, no question about it. Our phone lines, I represent the west and northwest suburbs of Chicago, and our phone lines have been lit up. Even before I was on this interview, I was talking to constituents personally who were very, very concerned, particularly on the spending side. And what they're seeing is the impact that this kind of big adventure in Washington, this big spending effort, is having on the economy. And they're not seeing the type of job creation that they were hoping for, and there is a great deal of reluctance and, in fact, opposition to what they're seeing, particularly on the health care side.
All right, you sound pretty negative here on a lot of different fronts. Maybe we shouldn't be surprised, but I'm just curious then, when it comes to health care legislation, at this point we know folks on both sides of the aisle are asking for a little bit more time here. Do you think this is not going to get done ultimately then?
Well, I think that ultimately we can come to a consensus on some good things. There's ways to enhance the doctor-patient relationship. There's ways to protect medical innovation and the type of advancement that we've all benefited from. There's ways to control costs thoughtfully, but we ought not just follow kind of willy-nilly on a plan that will ultimately lead to rationing, that is not going to deliver the cost savings, and in fact is going to increase the tax burden on our folks at a time when they can least afford it.
Congressman Roskam, you mentioned the doctor-patient relationship, you mentioned medical innovation. Do you think that they would be specifically harmed by this legislation? And if so, how?
Well, I think no question about it. You look at the doctor-patient relationship, which is already highly complicated because there's an insurance bureaucrat right now that's right in between doctor and patient. What Speaker Pelosi's bill would do is put a government bureaucrat into that. With this so-called public option government-run insurance plan, you would ultimately have a federal bureaucrat, an unelected federal bureaucrat, that's going to be making treatment decisions about our families. And the folks in my district are overwhelmingly rejecting that offer.
What do you say to the folks in your district who don't have health care and want health care, though?
So, look, there's no question that is where the action is. That's where we need to concentrate. But most times when people talk about the so-called 47 million Americans who are uninsured, when you really scrub that number down and you remove, for example, the illegal immigrants, if you remove the people who are just making an economic decision not to buy their own health care, then ultimately you get down to about a 12 million person number. That is a number that I think that we can all be united about, and we can concentrate on them, on expanding access and ability,
Gotta break in.
Not blowing up the whole system.
Sounds like lots of work to do. Congressman Roskam, thank you so much.